Now let's talk about our model. In order to build our model, we used many materials to ensure its proper function as well as for visual aesthetics. We used clay to build the bones in our model, specifically the humerus and the scapula. We used clay because it was easy to form and held together quite well in the correct orientation. We made a stand using a metal rod in order to ensure the model stood up. We were able to build the joint itself using half of a tennis ball with a small, denser ball inside, if you can see under there. This was all connected to an axle. This allowed us to move the joint somewhat while not completely destroying the model. The motions of the joint include flexion and extension, abduction and adduction, as well as some internal rotation. The muscles were made out of nylon, which we sewed together to take on a layered look, just how the muscles are actually. Nylon has the same structure and strongly resembles muscles and their collagen composition. Finally, for the tendons, we used a white gauze nylon sheath, which also was easy to manipulate and had the same collagen structure look-alike that the nylon had. Now let's talk about the major anterior features of our model. Let's begin with the humerus. We can see it is made out of clay and is painted white. Next, we did the biceps brachii muscle, which was cut, as you can see. Then we have the biceps brachii tendon right here. It's connected right to the glenohumeral joint. Next, let's talk about the muscles on the scapula. First of all, the scapula is made of clay and is hard to see because the muscle covers it, but it is under and is quite firm, as you can see. Here we have the subscapularis muscle, layered because that's how it actually is in the body, and the teres major, which extends from near the glenohumeral joint all the way down to the bottom and inferior angle of the scapula. Here we have the lateral border. And here we have the coracoid process, the acromion, two major landmarks, the supraspinatus tendon on top, the subscapularis tendon, which connects down to the subscapularis muscle, and the teres major tendon, which connects to the teres major muscle. The glenohumeral joint itself is right around here. Now, let's move on to the posterior features. The posterior features are somewhat different from the anterior features. Let's begin with the humerus once again, as we can see here. But on this side, we didn't include any major muscles or landmarks on the humerus because it wasn't very key to the glenohumeral joint. We can see right here as the scapula, there's the lateral border over here, and here's the scapular spine. The scapular spine connects directly to the acromion, which we saw on the anterior side. Now let's talk about muscles. Here we have the supraspinatus muscle, which connects above, superiorly, to the scapular spine. The supraspinatus tendon connects all the way through over here to the joint. Next, we have the infraspinatus muscle, which is in the middle, and as you can see, it has that nice layered look. The infraspinatus tendon connects all the way over here at the joint. Then, we have the teres minor muscle, which connects all the way through and is over the teres major muscle, which is really down here, as we saw on the anterior side, and connects right here to the teres minor tendon. Then, as you can see again, here's the actual glenohumeral joint with the motions and everything. And so that is pretty much a sum up of our entire model.